with COVID-19 situation here in South Korea. It has been nearly a couple of weeks since the government started its gradual return to normal life here in South Korea.
Yes, and while the numbers of infections and critically ill patients go up, authorities say the current uptick isn't overburdening the health system. Now, if numbers continue to rise, though, we might not be able to move to the second step of the COVID-19 exit strategy.
For one more time this week, we are very happy to say that our Shin Ye-eun is joining us in the studio. A wonderful good morning to you, Ye-eun.
Good morning.
Well, Yeun, let's start, as always, with the number of daily cases that's expected today.
So we're expecting to see Friday's figure hover at the 2,500s. Up to 9 p.m. yesterday, 2,153 cases were identified. This is 115 more than the number at the same time last week.
And do we expect the number of critically ill patients to go up as well? This has, as we've been reporting, becoming a rising concern here in South Korea.
It definitely has, and throughout the week, we've seen the number of critically ill patients go up, reaching another all-time high on Thursday. The tally was 473. To that, KDCA Chief Chung Eun-kyung cautioned that if the number keeps rising, the country could face difficulties moving to the second stage of the gradual return to normal scheme set for December. At the same time, authorities say the uptick is still within the medical system's current capacity, and there are plenty of hospital beds available. That's why they said now is not the time to discuss emergency plans that would reverse the easing of measures. They also attributed the number of critically ill patients to the length of this current wave of the pandemic.
We are seeing numbers go up because the pandemic has gone on for so long. That's why we also recognize this can affect our current medical capacity and are asking for people at high risk to get their booster shots.
Authorities are also considering reducing the interval between booster shots after the original jab from 6 months to 5, specifically targeting senior citizens. As of now, those over 60, younger people working in the healthcare center, and Janssen recipients have been getting the extra jab. And to make booster shots even more accessible, from today, authorities are allowing target groups to reserve leftover vaccines using Naver and KakaoTalk on the day they want their jabs.
Well, Yeun, we've heard that a South Korean company has seen some progress in terms of antibody therapies. Tell us more on that.
Right, so South Korea's Celltrion just received the green light from the European Medicines Agency for its antibody therapy called Recurona. Europe's drug regulators recommend the treatment for adults who do not require extra oxygen support yet are still at the high risk of severe illness. It's now just awaiting approval from the European Commission for marketing authorization, and Recurona has been found to lead to fewer hospitalizations and deaths. It's a monoclonal antibody that attaches itself to the virus and mimics natural human antibodies to fight infections.
Now, experts keep telling us that treatments are something that should be used alongside vaccines, and we're hearing from a senior official at Moderna, one of the big vaccine companies, of course, some information regarding the efficacy of their vaccines to fight these so-called breakthrough cases. What did they have to say?
Right, so Moderna said its COVID-19 vaccine actually has fewer breakthrough cases compared to Pfizer. CNBC reported on Thursday that Moderna's CMO touted data from the CDC that showed 86 breakthrough cases per 100,000 for Moderna recipients and 135 from Pfizer recipients. The CMO's comments came following discussions on the high percentage of young men reporting heart inflammation after getting Moderna shots, and data from France on males aged 12 to 29 showed there were 13.3 cases of myocarditis per 100,000 Moderna recipients, with only 2.7 among Pfizer recipients. But the CMO defended use of the vaccine, saying the protection it offers against hospitalization and death outweighs the myocarditis risk. He said unvaccinated people are at an 11-fold increased risk of dying, whereas reported heart conditions were generally mild.
Well, all right. Thank you, Yeun, for your reports throughout the week. We appreciate it. Hope to see you again soon.
Thank you so much.